A 911 first responder battling, 9/11 first responder battling stage 4 cancer says he can't afford medical treatments now after losing benefits from the World Trade Center Health Program. The program covers eligible first responders and survivors of the September 11th terror attacks at no cost. As News4Jax reporter Brianna Andrews explains, this is not an isolated issue.
Jeffrey Brown helped recover and remove bodies at the Pentagon. He says the WTC program paid for his cancer treatments up until last week. It's a problem he claims is also happening to other first responders. Thousands of first responders put their lives on the line during the 9/11 attacks. Jeffrey Brown is one of them and feels that they're being disregarded.
Yeah, everybody says never forget. I think it was forgotten pretty quick.
While at the Pentagon recovering bodies, Brown was exposed to toxic debris. Last year, he was diagnosed with stage 4 prostate cancer, which the World Trade Center Health Program verified as a direct result of his recovery efforts at Ground Zero. Up until last Tuesday, he says WTC covered all of his treatments at MD Anderson, but stopped after the program was taken over by a new healthcare provider.
MD Anderson told me that because they couldn't take this insurance or my private insurance, I would be responsible for the $17,500 for that one treatment, which I have to get every month. And in addition, I have to take medicine every month, every day. That's another $3,000.
WTC lists its new in-network providers online. Brown says he called but still couldn't find a place that took the new insurance.
When I reached out to the program, they said that they're sorry I'm going through this and they're working on it. And I still haven't heard back from them even now.
Desperate to get treatment, he hired attorney Woody Igu to help get answers. Igu sent this letter to the program's administrators and a caseworker just a few days ago. This letter is pleading for something to be done and stresses the fact that this could shorten Brown's life.
They just didn't do their due diligence and do their job regarding the transfer. Now people with stage 4 cancer like Jeff, and he's not the only person, are all at least going to be a week late on their active cancer chemotherapy or radiation.
NIOSH, the organization in charge of the World Trade Center Health Program, has reached out to Brown today and has set up an appointment for an infusion next week. He says there is no mention of his other medication and future infusions. Now, we also reached out to NIOSH for comment, but we have not heard back. Brianna Andrews, Channel 4, the local station.